Once we have diagnosed the case of osteochondritis dissecans after getting detailed history examination, doing the Wilson test, and once we confirmed our diagnosis on X-ray as well as MRI, then we decide whether what is the situation of the lesion and whether to go for non-operative or operative management. Usually, the most important thing which determines is the skeletal maturity or immaturity. In the case if it's a skeletally immature child with physis open, there is always very high chance of healing, and usually in this kind of a patient, we always go for non-operative treatment. And if the child is a young adult, for example, has crossed the age of skeletal maturity and the physis have been closed, then probably we'll have to get a close look. We start with non-operative treatment, keep the patient on follow-up, and if it's not working, we move towards the operative treatment. But if it's the case of adults who have developed this problem in the old age, then probably we may have to go straight away for the operative treatment. So the most important factor which determines whether we are going for operative or non-operative treatment is actually the open physis. Usually in children, it's most of the time it's always one thing, and that is actually the activity modification along with the bracing. We can, if the child is, let's see, 8 to 9 years or 10 years of age, we can go with the knee brace and knee immobilizer along with the activity modification. Like we can ask them not to play or do this activity for a prolonged period of time, and usually bracing is done for 4 to 6 weeks, because for that time actually the knee is immobilized in certain fashion and it cannot move, therefore it gives time for the lesion to heal over the period of time. Most of the time this treatment is more than enough for most of the children with the open physis. But for example, if the lesion is not a common one, for example, if the lesion is around the lateral femoral condyle or in the surface of patella, usually there is less likely chance of healing, but most of the time these lesions also heal with protective weight bearing and activity modification. But if these lesions do not heal and we may have to go for certain other options, like which could be operative treatment as well. But with the most of the time, 80 to 85% of the time, if we ask the children, we give them brace or knee immobilizer for 4 to 6 weeks and give them break from the activity, usually 80 to 85% of the lesions usually heal over 4 to 6 weeks of the time, and this treatment is more than enough. So whenever we are talking about the treatment of osteochondritis dissecans, give them rest, give them brace, and that's it. You don't need to do more.